In this module, we will talk about risk and how we can decrease our organization's exposure to it. We will break this topic down over 2 presentations. In this presentation, you will be introduced to some of the terms and tools used in the area of risk, along with the rights of the patients. In our second presentation, we will focus on building a safe medication management system and how it relates to risk and quality. By the end of this module, you should be able to do everything listed on this slide. What is risk management? Risk management is a comprehensive program intended to decrease the potential for injuries to occur in your facility. It also includes anticipating injuries that may occur and responding to injuries, along with any associated liability, should one occur. An injury can be physical or psychological. Typically, a facility will have a risk manager who coordinates these duties. Risk management can be found in industries other than healthcare. For example, the car industry has an extensive risk management program. Let's start with a little background information. Protecting patients from unintended harm has always been a high priority for healthcare professionals. By reducing or preventing injuries, the patient's safety is improved. Patient safety improvement is a subset of an organization's overall quality management system. Patient safety must be measured and the data evaluated to identify improvement opportunities. However, in spite of this philosophy, thousands of patients die every year as a result of preventable errors. Back in 1999, the Institute of Medicine published a report on medical errors in healthcare. This report was called "To Err is Human: Building a Safer Health System." It was reported that between 44 and 98,000 people die in hospitals each year as a result of errors that could have been prevented. And according to several recent studies, there really has not been a significant improvement in these numbers. In addition to patient safety and trying to reduce the number of preventable errors, healthcare organizations and physicians are susceptible to claims of liability. From a business perspective, we want to avoid being sued. Risk managers seek to manage the organization's risk exposure and improve its processes so that the threat of liability is minimized. It is important to improve the process because even the most competent professionals can make a mistake. In most cases, if the system was improved, the error could have been prevented. It is usually the system, not the people, where the problem lies. If you haven't already done so, you will want to review the key terms found in the Resources section of this module and make sure that you understand their meanings. If you have any questions, please let me know. Before we continue our risk management discussion, let's take a look at our patients' rights and responsibilities. Patients should be encouraged to speak up, ask questions, and report concerns about safety. Some providers are actively involving patients, family members, and laypersons in safety improvement initiatives. Now let's take a look at the steps an organization can take to help decrease their risk exposure. First, the healthcare organization develops a risk management plan, which includes updated policies and procedures. The plan should also include their insurance strategy, whether they want to take out liability insurance or they want to set money aside and be self-insured. Claims tracking and negotiation system, how databases are maintained and risk management reports are developed, review of operational policies and procedures of all departments to ensure that they have been designed in a way that reduces risk exposure, design requirements of occurrence reporting and reporting to insurers, licensing agencies, public health departments, governing bodies, the National Practitioner Data Bank, and other accrediting and regulatory agencies. This slide lists some examples of what might be a reportable event. Next, the plan and concepts must be shared with all employees. This may include hand washing techniques, needle safety protocol, and how incidents should be documented and reported. In the third step, the team evaluates any occurrence or incident reports that may have been received. Effective occurrence reports carefully structure the collection of data, information, and facts in a relatively simple format. Many organizations have moved to an electronic format for submitting occurrence reports. In step 4, the risk management team examines structure, process, and knowledge issues by using data collected and reported by organization-wide and team-based performance improvement activities and determines corrective action and strategies to reduce risk. In step 5, the team identifies practice patterns, trends and risk occurrences, and sentinel events through the use of aggregate data summarized from the occurrence reports. Identify trends and risk occurrences within the organization. Graphical tools, such as a bar chart, can be helpful when evaluating and displaying your data. These tools may make it easier to identify trends and common factors that contribute to incidents. Step 6. The team helps the patient through the advocacy function. This may involve offering support to the patient through difficult interactions with the healthcare organization. It is also important that the customer, like the patient or the patient's family, know the facts associated with the occurrence. Next, the team communicates all relevant data and information when potentially compensable events or PCEs occur, coordinates all legal activities, responds to subpoenas, coordinates all employee dispositions or court appearances, if applicable. It is also important to communicate with your organization's insurer. The risk management team's last step is to work together with the organization in the development of an appropriate insurance strategy for the organization. This is developed with reference to the healthcare service lines of the organization. This slide provides some examples of how you might measure patient safety. Remember, if you do not measure it, you really do not know how well you are doing. Let's take a look at some quality tools that may be used during the risk management process. Of course, some of the other tools we have discussed in previous modules may also be used when collecting data and displaying our data. We will be adding the FMEA, or Failure Mode Effects Analysis. It may also be referred to as the FMECA, or Failure Mode Effects and Criticality Analysis, the cause and effect diagram, or fishbone diagram, and the root cause analysis to our toolbox. With the failure mode and effects analysis, the team uses a proactive approach to improve patient safety. This formal and systematic assessment method is used by the team to anticipate what might go wrong with a product or process, identify how a product or process might fail, and the effects of that failure. FMEA also helps find the possible causes of failures and the likelihood of failures being detected before they happen. This technique promotes identifying potential failures, failure points in current processes, and the scoring of each potential failure by considering factors such as frequency of failure, potential harm, and the likelihood that the failure will be detected before it reaches the patient. You may not realize it, but you probably use FMEA almost every day, but on a more informal basis. What could go wrong? If it went wrong, what would be the result? What needs to be done to prevent a bad result when something does go wrong? Another common quality improvement tool used for risk management is the cause and effect diagram. The cause and effect diagram is often referred to as the fishbone diagram because it looks like a fish. The problem, or effect, is written on the fish's head, while the contributing factors, or causes, are written on the bones of the fish, branching off of the backbone. It is not necessary to draw the outline of the fish as is shown on this slide. The contributing factors of the situation are delineated into 4 areas. The example on this slide includes the areas of manpower. It examines influences of the human worker on the situation. Materials examines the influences of supplies and equipment on the situation. Methods examines influences of policies and procedures on the situation. And machinery examines influences of machines or other major pieces of equipment on the situation. Other Fishbone diagrams may use slightly different names for the categories, such as people, technology, policy, and management, or other labels, or it may be necessary to have more than 4 categories. It will all depend on the organization or the issue you are investigating. Look for the underlying system problems, dig deeper to find the root causes, the most fundamental reasons the event occurred. After constructing the diagram, the team brainstorms the possible root causes of the problem from all aspects to identify how each contributed to the occurrence of the event. It is important to keep asking the questions why until the absolute root cause has been discovered. There may be many underlying causes, some of which may be the root cause of the sentinel event. The goal of the root cause analysis improvement model is to identify fix root causes, and develop new systems to prevent reoccurrence of that same event. Joint Commission standards and some state regulations require root cause analysis after a sentinel event occurs. Don't forget, there are 2 presentations within this module. Our risk discussion will continue in presentation number 2.